Great. Okay, well, good afternoon, everyone, and welcome to today's GNC Annual Meeting Satellite Event on Nutrition Coordination in Refugee Response Settings. My name is Bryony Stevens, and I serve as the Coordination Help Desk at the Global Nutrition Cluster based in Geneva. I have the privilege to introduce the speakers for today's event. So joining us today, we have Terry Njeri Turi, Senior Nutrition Officer at UNHCR HQ. We have Isaac Kamazi, a Nutrition Officer at UNHCR Uganda, and Bakadir Rahimov, Nutrition Sector Coordinator at UNICEF Cox's Bazar. So Terry, Isaac, and Bako, many thanks to you for your support with the satellite event and for joining us today. So the purpose of today's event is to discuss nutrition coordination in refugee settings. Also available guidance to support nutrition coordination in refugee contexts, and to also learn from various contexts, including Ethiopia, where the humanitarian program cycle is activated, Uganda, where a traditional approach to coordination of refugees is applied, and from Cox's Bazar, where a unique coordination approach is applied in light of the context there. In terms of run of show, we will first hear from Terry, who will discuss the various coordination mechanisms and guidance in respect to refugee contexts. This includes both contexts where the HPC is activated and non-activated. We will then hear from Isaac, who will speak about nutrition coordination in refugee settings in Uganda, which reflects a more typical approach. And we will then hear from Bako on nutrition coordination in Cox's Bazar. So this reflects more of an atypical approach. After we hear from our colleagues, we will then have a short Q&A where we will open the floor for any questions that you may have. That said, please also feel most welcome to use the chat box throughout the event to raise any questions that you may have. We will aim to address these questions either directly in the chat box or during the Q&A. Also, just a flag for the questions raised, we also plan to use these to develop a short frequently asked questions two-pager, which will be shared shortly after today's event. So without further ado, I will now hand over to Terry. Over to you, Terry. Thank you.
So good morning, good afternoon to everyone, depending on where you are. I will go straight into the presentation. Next slide, please. So firstly, I'll just start by looking at what the displacement figures at a global level. And just from the slide there, globally, we have approximately 82 million people that are displaced, 26 million of which are refugees. These are people who have fled war, violence, conflict, or persecution and have crossed an international border to find safety in another country. Next slide. So looking at the general humanitarian coordination, we have the ISC cluster approach that was designed in 2005 to coordinate the international humanitarian response. And this is in non-refugee humanitarian emergencies. And this allowed for predictable lead agencies for internal displacement. International law and practice addresses refugees and internal displaced emergencies differently. For refugees, the mandate and accountability has always been in place since way back in 1950. And the scope of refugee protection and assistance is linked to finding durable solution. So this means that it goes beyond the coordination of an emergency and humanitarian assistance. Just to be specific on why, refugees are treated differently. Refugees are not citizens of the country of asylum and therefore are people with very specific vulnerabilities and a set of rights because of this particular status. They need humanitarian assistance, but have, beyond this, they also have other wider needs. They require international protection to find safety and to seek durable solutions. Often refugees will face, restricted movements. When they get into a country, they have to be recognized. They have limited access to livelihood options, social safety nets, basic needs, and encounter things like language and social cultural barriers. And in general, usually protecting refugees is primarily the responsibility of the host state. And UNHCR is mandated to ensure the provision of or provide protection, assistance, and solutions for refugees. The latter is determined by the capacity of the host government. Host countries usually will contribute significantly to a response depending on their capacity. And this usually includes, access to territory, protection from refoulement, providing land and other environmental assets, security, or even allowing refugees full access to, services, extending the same services as the host population. Refugee emergencies frequently occur in fragile contexts in which the vulnerabilities of the host community are high. Therefore, UNHCR and partners in refugee operations work closely with and invest in communities hosting refugees as a means of avoiding conflict, promoting equity, and preserving asylum space. Next slide. So, I noted that, the coordination of refugees uses the Refugee Coordination Model. And the Refugee Coordination Model usually is applicable in all refugee emergencies and throughout a response, whether it's a new or protracted emergency or located in a camp or in an urban setting or in mixed situations. Refugee Coordination Model is anchored in the broader humanitarian coordination structure, and it articulates the standard elements of coordination within these settings. It will usually clarify how UNHCR leads and coordinates the response in support to the host government. It offers an inclusive platform for planning, coordination, and advocacy to allow timely, effective, and quality protection and solutions for refugees that meet global standards. In terms of, how does this model engage with partners? UNHCR involves partners in the various processes, right from the strategy development to operational decisions. And, through this, the various actors are able to plan for refugee needs. And this includes calling for leading needs assessments, contingency planning, information management, and response planning. Usually we have the refugee sectors, and this can be coordinated by partners under the leadership of UNHCR. Co-leadership is recommended where possible, but using refugee tools and guidance. UNHCR also provides partners with a fundraising platform through the interagency refugee response plans, which can either be at country level or at regional level, depending on the situation. Some of the situations affect multiple countries, thus regional in nature. So generally, partnership inclusivity principles are applied, and the core is to have the right people to plan, fundraise, and execute the plan based on the interest of the refugees. Next slide. So looking specifically, next slide. Looking specifically at the public health and nutrition sector level. Usually, UNHCR will engage with partners ranging from operational partners, implementing partners, and will ensure that regular coordination is in place to be able to address various arising issues and ensure there's information sharing. Usually at global level there is MOUs that guide this. So there's MOUs with UN agencies like WFP, UNICEF, WHO, and when we look at the nutrition sensitive with FAO and the rest, we also have MOUs with operational NGOs, their partnership agreements that are drawn with partners, implementing partners, whether CBOs, local NGOs, NGOs. And this usually is to help guide the response plan of actions and ensure that the division of responsibilities at the country level are well understood. In the case of UN partnerships, there are global MOUs that exist. So at the country level, usually they just need to be adapted to the country context. Monitoring for the nutrition response follows the drawn joint plan of actions or the drawn agreements. Data reporting, usually we'll use the integrated refugee health and nutrition system, which usually is shareable with the various partners depending on the various accountabilities. And usually the refugee sector, and we'll see this when Isaac does the country example for Uganda, the refugee nutrition sector will usually feed into the national level sector platforms, and where possible, usually UNHCR and the refugee response partners participate in the national level working groups, especially in regard to the core nutrition components, CMAM, MIYC, and scaling up nutrition. And this is usually at that level can either be led by the national sector nutrition platform, or at times it's a cluster. Next slide. So this slide details some of the various tools and guidelines that are used in refugee programming, like right from the needs assessments, planning, and implementation. And some of these tools, of course, are used in conjunction with the national guidelines. Next slide. So going to the second context, this is where we have a mixed situation, and by a mixed situation, we have refugees and IDP emergencies occurring at the same time. And at times, either we have the two different population groups in separate locations, or they can be in the same location. So for this context, usually the 2014 joint UNHCR OCHA note on mixed situation coordination in practice applies. And this note defines the mixed situation. It also defines the different arrangements that should be put in place. It notes that a healthy and functional humanitarian system is one that harnesses diversity and expertise to bring out the best outcomes for the affected population based on comparative advantages. And comparative advantages in this case comprise of mandate, responsibility, expertise, and capacities. It delineates the respective responsibility of each OCHA and UNHCR, underlining the principle that refugee coordination is led by UNHCR as an integral yet distinct component of the wider humanitarian response. OCHA coordinates the preparation, implementation, monitoring, and reporting of the country humanitarian response plan. Then UNHCR leads discussions with the HCT on the refugee response and coordinates the development of the refugee response chapter in the HRP. At times, we also have separate plans as noted earlier, in terms of either the country refugee response plan or the regional response plan, where the emergencies of a regional nature. Where IDPs and refugees are in separate locations, clusters and refugee sectors continue to provide assistance to the respective population groups separately, with close exchange of information at the capital level. Where IDPs and refugees reside in the same locations, usually the HC can decide to use either the UNHCR refugee sectors or the ISC cluster approach capacities, but the accountabilities of each remain the same. Where the ISC cluster approach is agreed on, refugee focal points are assigned to the various clusters to ensure refugee-specific protection aspects are considered in the response planning. So just looking at a case example of Ethiopia, you'll see the government and UNHCR are responsible for the coordination of the response there. We have the cluster approach and the government UNHCR coordination mechanisms being separate. If you look at the HRP, which is a country-specific HRP, it reflects an excerpt from the Ethiopia country refugee response. So, so for the refugee side, we have the refugee coordination model being used, and that goes also for response and reporting. We have the various working groups and sectors. Nutrition is merged with health, and also addressed under the food security refugee response. There was a question where someone asked, what happens when we have, can we have the same partners working in the same context? Yes. While nutrition partners are engaged separately, it is also possible to have one agency working in both with both coordination mechanisms. So this is just a photo showing the response plan, the Ethiopia country refugee response plan. That's the humanitarian. Oh, sorry. Next, yeah. On the left, you have the Ethiopia country refugee response plan. Then we have the humanitarian response plan in the middle. And the table on the right, it's not very clear, but the last on the left bottom, it just shows the chapter that has the refugee response included in the HRP. Next slide, please. So this slide highlights a few challenges faced in refugee settings when it comes to coordination. And, from the various notes from the presentation slides before, addressing refugee needs requires consideration of their specific vulnerabilities. And there are refugee-specific tools and guidelines that support this. Hence, UNHCR's oversight and involvement in the planning and development of responses right from the beginning of an emergency allows for these considerations to be put in place. And at times when this is not observed, we face various challenges in terms of, the programming not always serving refugee best interests in the medium and long term, as providing refugee support usually goes on until a durable solution is found. And secondly, at times you will find, coordination and partnership challenges among partners can affect timely delivery of responses. So next slide. I think I will hand over now to Isaac to just highlight the case example from Uganda. Over to you, Isaac.
Thank you so much, Terry. Good morning and good evening, everyone, depending on your location. Yes, my name is Isaac, and I'm the Nutrition and Food Security Officer for UNHCR based in Kampala. Okay, next slide. So Uganda is the biggest refugee response in Africa at about 1.49 million refugees and asylum seekers, and a majority of whom are from South Sudan. That's 62%, DRC about 29%, and Burundi 3%. Then we also have a number of other nationalities. And these are spread across 13 refugee settlements. We do have a settlement setting, and the rest of them are in urban areas, mostly in Kampala and the catchment areas. And in Uganda, government, through Office of the Prime Minister and UNHCR, take lead in coordination of the Uganda refugee response. But then we are supported closely by other government line ministries, UN agencies, the district local governments, because the settlements are in respective districts, which have leadership. Then partner organizations like the implementing partners, operating partners, and the private sector. Next slide. Yes, so the Refugee Coordination Model in Uganda is informed by the Uganda Refugee Response Plan, or the RRP, and the regional response plans, like Terry mentioned, because we do have situations that span across different countries. For example, the South Sudan situation, and the Refugee Response Plan basically is a transition plan towards sustainable refugee response in Uganda, which also helps to contribute to the achievement of the comprehensive refugee response framework, on top of other interventions that have been done previously by the government. So we see that this RRP recognizes that there is a paradigm shift in Uganda, where we're moving towards inclusion and self-reliance, moving away from care and maintenance. So basically, the delivery of the refugee response in Uganda is turning towards the fact that we're moving from an emergency. We're currently in a protracted emergency, and the refugees are here to stay. So as they're looking for the durable solutions, they might as well be included in this inclusive development of the country. And we see that refugees progressively benefit from provision of these inclusive basic social services. And basically means that all the different services that are offered today have a bit of a resilience component to them that includes health and nutrition. And we do it in a way to include the refugees in the different country mechanisms. And we see that the sector strategies within the refugee response and the priorities have to be aligned to the existing government sector's response plans. Okay, then with this RRP, it has quite an enhanced results framework, which monitors the performance, but then also sector needs analysis that are informed by the different assessments that we do. In terms of the leadership, there is government co-leadership. So every sector that there is a refugee response is co-led by a different government entity. It could be a line ministry. And this helps because in a way we are able to include refugees into national planning, or even at the national level and at the district level, by having this interface with the government. So already a number of response plans, sector response plans have been operationalized. For example, nutrition falls in health and nutrition as a sector. There is already the health sector integrated refugee response plan, but then there is also other response plans like in education, jobs and livelihoods, energy and environment, and all these support the inclusion of refugees into national systems. So to give an example of this inclusion within the health sector, during the planning for vaccines at the district level and the national level, refugees are put into account. When you look at nutrition commodities, for example, RUTF, the projections are done at the district level, and the procurement is channeled through the national medical stores, and also the last mile delivery, meaning that the government through the national medical stores is actually in charge of delivering the vaccines, the nutrition commodities up to the health facilities. So this is one way of also strengthening the government systems, while different agencies maintain a bit of buffer stocks to support whenever there is pipeline breaks. Then also health information systems. Right now with the district health information systems in Uganda, we see that the data is actually disaggregated by refugee and national. So that was a commitment within the refugee response to support the government system in streamlining health information systems. So when we look now specifically to nutrition, This is within the refugee response. It's coordinated through the Refugee Health and Nutrition Sectoral Coordination. But then how does it interface with the national system? Like Terry mentioned, this is through the different higher level coordination mechanisms like the Nutrition Technical Working Group, which is chaired by Minister of Health and co-chaired by UNICEF. But then we also have the Nutrition Multi-Sectoral Collaboration, where the SAN Secretariat sits and the Nutrition Governance that is under Office of the Prime Minister. And these two are the main drivers of the nutrition agenda in Uganda. Next slide. So I don't know if you're able to zoom in a little bit, but this is the coordination structure for the Uganda refugee response. But basically, what happens is that all these sectors, the second last row, these are different sectors, and each of these different sectors, it's a government entity paired by, say, UNHCR, maybe another entity. It could be WFP, it could be a partner. So this, in a way, encourages this national dialogue of inclusion of refugees. And this is at the national level, but then at the bottom, we also have the subnational level where we have refugee settlements. And again, this same structure replicates where at the settlement, we also have the health and nutrition, which can still be further broken down to the nutrition technical working group. And these also feed into the the district technical working groups, which are still led by the government, the district local governments. So all these are the different structures, the different sectors, and the different working groups within the Uganda refugee response. Next slide. So now zooming into nutrition, looking at the interface of the coordination. So we see that this first row, the second row, rather, these are government, where we have the Nutrition Technical Working Group and the multi-sectoral collaboration. These are two government offices, but then also the Nutrition Development Partners Group. So this is strictly UN and the local donors where we get to discuss issues more internally. So this is where now the National Refugee Health and Nutrition Coordination feeds into. So basically the discussions we have within the refugee feed into these coordination mechanisms, which are higher, but then also the other way around. When we also sit into these, because UNHCR participates in all these coordination structures, we're able again to pick issues and feed them back down into the National Refugee Health and Nutrition Coordination. And as I mentioned earlier, we also have the settlement-based refugee health and nutrition coordination mechanisms, which also feed into the district counterparts, which eventually feed into the national dialogue. And in terms of, say, how, again, the Nutrition Technical Working Group coordinates, it has a number of pillars where we address nutrition in emergencies, IMAM, MICAN, where IYCF falls, the NCDs, anemia, child health days, and M&E. And we've delivered a number of products over the years with for example, guidelines on IMAM, SOP strategies, the Zero Hunger Strategy, the Uganda Nutrition Action Plan. And in all these different documents or policies, the refugees have been represented. We've been able to capture the different refugee issues to have at least a national representation. Then what do? We also do joint planning, technical support, resource pooling. So as much as each agency may have their own operational plan, we put together all those different plans to come up with a national outlook and the picture of where we want to head as a country. So that's to say that the nutrition agenda in Uganda is largely government-led, while the rest of us support. So now when it comes to the different UN agencies within, say, the operational space of the refugee response, there is division of labor, which is informed by our local letters of understanding, which are country-level documents, but then also our international MOUs that Terry mentioned, but then also the comparative advantage, which again informs this division of labor. For example, UNHCR supports things to do with inpatient and outpatient therapeutic care for management of severe acute malnutrition, but then UNICEF comes in to support with commodities and nutrition commodities and a bit of mentorship. Then WFP comes in to support the component of supplementary feeding program. And we could still have the same partners. We could have the same partners supporting all these different core areas. While there is also areas of common space, like, for example, MICAN, IWCF. So all of us put in our resources to support, to strengthen systems, to improve optimal feeding. So this is an area that is open to UNICEF, WFP, UNHCR, and all of us support. With also our sister agencies like FAO and WHO that support at a much more national level. Then challenges. Yes, this is without challenges. We do have challenges because as much as nutrition is government-led, it is highly donor-funded, almost all of it. So government only comes in terms of supporting its human resource budget. So that frustrates government efforts when they want to support coordinating of field activities, which also affects the pipeline. For example, the nutrition commodity pipeline, as much as it's through the government, the resource pooling comes to the donors. So the government hasn't allocated money to support some of these activities. But as we move forward, there is advocacy that at least nutrition gets a bigger bargain within the health sector budget. I think that is it from Uganda. Thank you so much. Over to you.
Thank you very much, Isaac. That was a fabulous presentation. So we'll now hand the floor over to Bako to speak about COPS's Bazar. Over to you, Bako.
Thank you so much, Brioni. Can you hear me? Is it fine?
We can hear you, yes.
Excellent, excellent. So good evening from Tashkent, guys, and thank you so much for this opportunity of sharing the Cox's Bazar experience. But before starting, I would like to present the humanitarian, I would like to present the humanitarian sector coordination system in Cox's Bazar, showing the examples and measurable results of successful cooperation between UN agencies and implementing partners in the Rohingya camps, but one more time, maybe from the beneficiaries' perspective, beneficiaries' point of view. And before the presentation, I really would like to thank Mary. I see she's here from UNHCR. She supported me a lot in drafting the presentation and overall general work in Cox's Bazar, but also Dr. Maina, who joined the Cox's Bazar operations. He's a great colleague and I believe a friend from UNHCR. Besides that, I also would like to thank our colleagues from World Food Program, Tracy and Claire, and also Piali, I see she's also joined here, and Dr. Karanvir from UNICEF for supporting the nutrition sector's coordination in general. And of course, special thanks to the GNC guys, colleagues, and especially Brioni for guiding us through the satellite event. Next slide, please. Sorry. In Cox's Bazar is one of the refugee response humanitarian site, and I see the quite similarity with the previous presentation. There are over 800,000 Rohingya people located in Cox's Bazar, and recently has been moving to Bazar and Char Islands, but this is additional special subject of discussion. Rohingya communities live in 34 demarcated camps, and according to SMART survey, there are over 11% of GAM prevalence in children under 5. And this is the ISC-led response, and definitely, you know, maybe without presence of UNOCHA since 2017. Under the ICG, there are different thematic sectors, and including nutrition. Next, please. Thank you. As I mentioned before, the ICG is the main coordination board, and the nutrition sector's coordination unit is under the ICG's programmatic support and directions. The field partnership are based on the local and the global agreements between different UN agencies. For example, UNHCR and World Food Program has a global one, and there are a number of local agreements, and UNICEF and UNHCR also looks forward to have additional agreements, for example, in data exchange, which is very important and crucial. Each UN agency has program cooperation agreements and funds allocated for providing OTP, Outpatient Therapeutic Program, TSFP, and BSFP services for the Rohingya camps and host communities. Host communities is a bit different story. Maybe later on we will be able to share what is the difference. Next, please. So UNICEF, with support of ECHO, maintained the nutrition coordination unit. So it's like a unit for supporting entire Rohingya nutrition response. And in 2021, too, ECHO also stepped in to support the coordination unit. Global UNICEF's role in the nutrition cluster, it's well presented in Cox's Bazar, but however, we have also very strong consultative and cooperative program environment in Cox's Bazar. and each partner is well presented there. I want to stress your attention here on the sector service network rationalization, because previously I said that the presentation will be from the beneficiary's perspective. So generally out of 84 over the nutrition centers, nowadays there are 46, but they're all integrated in the camps, and integration between UN agencies providing specific services. So all camps programmatically split between UNICEF, UNHCR, and everywhere is a World Food Program for providing OTP services. So I said World Food Program is presented in each camp and provides support to TSFP and BSFP. So integration of OTP, TSFP, and BSFP services at a single point, so-called one-stop shop, is possible to do in general. I know that many partners, many nutrition colleagues face this challenge of integration, but in Cox's Bazar it was possible. And this is because of commitment of each UN partner. And I want to emphasize attention on the integration of services within the nutrition facility. I strongly believe that the service integration is really tangible and positive results of a great cooperation and coordination between all UN agencies implementing partners, which might be replicated globally in different humanitarian contexts. So we are happy in Bangladesh to share our experience in the service integration and rationalization. Next slide, please. Oh, it was, I think, yes, this one. So as everywhere we use GRP, as previously mentioned, this is the big platform for coordination in Cox's Bazar. However, we have also different platforms for ongoing in-process coordination and coordination between implementing partners and UN agencies. So one of them is SAC. Here is specificity I want to emphasize that SAC consists of each nutrition sector member. So it's 3 UN and 6 implementing partners. So we use GNC recommendations in forming of SAC in small number of partner settings. So GNC handbook is quite nicely explains it. With that, we ensure that presence of each voice in the decision-making process and coordination of joint efforts. Technical working group is also a bit specific and advisory role. We invited implementing partners to chair the technical working groups and provide advisory role for the sector. For example, Save the Children International leads and support IYCF. ACF supports, leads the information management and assessment technical working group. Medair with SARPV leads CMAM. So GNC colleagues, they're very well aware of during all the meetings, you can see the different partners. So we try to engage them more and more. Information sharing and knowledge exchange is really core contributing factor for better coordination. For that reason, there is a GRP-led 4W, and you can visit it online and study the progress towards GRP targets and other performance indicators. So here's the platform, and later on, Brioni can share the link, and you can really study how the 4W collects and presents the information for entire sector. Next, please. Thank you. Oops. So if the first evidence of successful coordination and cooperation between UN and implementing partners is the service integration within the single nutrition facility, the next is the overall evenly spread quality of nutrition services in the camp facilities. So you can see, for example, here, that coordination of the programming efforts leads to steady decline of SAM prevalence in the children under 5. However, all the sector understand that now we have to pay more attention on reducing of MAM through the engaging communities in the nutrition program. And that is really crucial. All sector partners take human rights-based approach to fulfill the rights of refugees to nutrition services. And this is very well accepted together with other gender protection, disability programs now integrating into nutrition services. So more information you can really find in the recently published article using the providing links. Below you can see the reference. Recently we were able to publish these findings of the sector rationalization. So those who are more interested in data analysis and findings, you can visit the website and definitely read and give a feedback to the team of authors. Yes, and the next, please. So you see that in general, I tried to present the situation, an example from Cox's Bazar. It's a bit specific one, but in general, what we see that nutrition sector coordination role under the ICG engages all UN agencies and partners and gives the overall equal platform for sharing the knowledge, information, and definitely joint decision making. The global and local agreements between UN agencies and IPs, you see that can support implementation of GRP and synchronize all our efforts. And we have tons of examples to show how it's possible to replicate in other countries. The nutrition sector coordination system would try to maintain, generate, and exchange of evidence through different platforms, and 4W is one of the core, but other surveys and evaluations also contributing to overall generating the information and decision-making process. In the presence of comprehensive nutrition services, which I mentioned before, it is integrated and rationalized in the camps, is one of the direct joint contribution of all UN agencies and partners. And here I can really say now from beneficiaries' perspective, more important to observe in the camps. Over. Thank you.
Many thanks, Bako, for that presentation. So we have now come to the next steps and also the Q&A. I see that we have 5 minutes for the next steps and Q&A, so I'll just quickly run through the next steps. So regarding the next steps, given the GNC's expanded mandate to support nutrition coordination before, during and after emergencies, and to view nutrition holistically in all its forms, discussions will continue on how to better support nutrition coordination in refugee contexts and across platforms. So this applies to typical refugee response settings, mixed and also atypical settings, such as what we just heard from Bako. So these discussions will be guided and shaped by the development of the next GNC strategy. But in summary, efforts will be made to better disseminate available guidance across settings, regardless of the coordination structure. Efforts will also be made in terms of strengthening collaboration across platforms, for example, between a nutrition cluster and a nutrition sector in a mixed setting where the HPC is activated. And lastly, just as mentioned, we will also develop a frequently asked questions 2-pager based on some of the questions that may be raised today and other questions that might be shared bilaterally, and that will be shared shortly after this event. So with that, I'll use this as a segue to now open the floor for any questions that you may have. Okay, so I see that we have a question raised by Alessandra and Alex. Many thanks for your question, Alex. So what do we foresee for refugee contexts that are chronic in nature? What type of solutions? And is the traditional coordination the solution? So I might hand that question over to Terry. Over to you, Terry.
Just read for me, Briony, the question again.
Sure. So the question that was raised, it's just a little bit tricky to see. So what do we foresee for refugee contexts that are chronic in nature? So I guess that would be similar to what we heard from from Uganda, and what type, and also Cox's Bazar, and what type of solutions, and is the solution a traditional coordination? So the question is raised in the chat box there, Terry.
All right. There's one aspect of coordination that I did not cover while I was doing this presentation, and that's in terms of, you know, the various platforms that are being looked into in terms of looking for long-term solutions for refugees. Usually, you know, we'll have the humanitarian platform, we have the refugee coordination platform, and we also have the development platform. And this ties in with the point that was raised that for refugees, you know, it's not just about the humanitarian emergency phase, but they usually will require support until a durable solution is found. And one of the platforms, you know, in addition to the refugee coordination model that is in place is the Global Compact for Refugees. And this is mostly, you know, that is signed by many of the member states. And this coordinates quite a bit with various other sectors, including the development partners. And this, you know, highlights the need for looking at solutions that build resilience of refugees, and of course also looks at the other solutions that's in terms of looking to whether we can expand access to resettlement and other pathways, or having safe voluntary returns to home countries. And for the countries that are hosting a lot of refugees, like the case we saw for, say, Uganda, looking at how at a global level, you know, countries are able to ease pressure on these countries by supporting them more so that they're not taking the most of the burden. The burden is shared. So I would say for long-term solutions, you know, it takes working from, you know, from all angles at the country level, advocating for returns, advocating for resettlements, just looking at the various forms of solutions. And also, when we look at emergencies, also having advocacy in place where we're not just looking at assistance, but you know, looking to whether, like in the case of Uganda, where you're looking at what are the other resilient options that we can have that can allow the refugees to just not rely on their assistance, but are able to, you know, get better livelihood options, even when they are hosted in various countries. I hope that answers that it's a multi-level, multi-sector issue.
Thanks very much for that, Terry. And speaking of multi-sector, we have a question from Bridget. So this will be, I guess, a question for Bako as it pertains to Bangladesh. And Bako, maybe you could share with us more information about the integration with health services and whether this has been successful. Thank you.
Thank you so much. I will be very brief. Now in Rohingya camps, the COVID-19 pandemic lockdowns, and what we are going for, and politically, I'm quite happy to inform you that with ICG support of UNICEF colleagues in Dhaka, finally, the RRC, the coordination board for Rohingya response from Bangladesh government side, accepted that health and nutrition are life-saving services. This is the first great win. It was really difficult to mention, and they always tried to mix the role of nutrition with other sectors and didn't accept it as a life-saving services. So first win, we are now part of the health, and in any documents which come from the government level, we see health and nutrition services. Health and nutrition. I think this is politically strong win for nutrition sector as it is in Cox's Bazar. You see that the second situation here with the integration nutrition service with health, There are different modalities, and now what I see, the health sector is also going through the process. They're planning the rationalization. You know that there are, according to my knowledge, maybe Mary can help me, over than 300 different level of healthcare facilities now in the camps, you know, and referral system is quite challenging. But what is the one area where we're stepping in, and thanks to all UN agencies, they accepted it by default, that our area of interest is pregnant lactating women. Specifically, we share the SRH program on management of pregnant lactating women with anemia and malnutrition. So here the area where now UNHCR is taking lead to go through overall testing the opportunities. With UNICEF support, we're also going through how it will be possible to support and develop at least the referral pathways between rationalized nutrition facilities with lower numbers but integrated services and health. This is painful, honestly. Previously, I'm a health specialist, and I know exactly where is the areas of coordination and integration, but where also the challenges. Here, I have a quite good number of colleagues here also. If they want to add, maybe Piali or Mary, about it could be wonderful. But from my side, yes, we are going forward to health integration. First, WIN, government accepted nutrition as a life-saving, and this is the first starting point to go forward with further integration on different services and programs for the broad integration with other services, which health like IMNCI and CMAM program, which could be in progress, in particularly possible later on maybe. So over to my colleagues, if Piali and Mary want to add to this, could be wonderful. Over from my side.
Thank you, Bako. And I just want to add a quick point. In addition to what Bako mentioned, what we are also doing, and this is not in all the camps, but in some of them, what we are trying to see is even how IYCF can get integrated within the health system or the health facilities which are there at the camp level. So that is the other level of integration we are looking into. And then finally, all these pathways at some point will come together. That's the long-term vision. I'll just stop there. Thank you.
Thank you, Piali, for adding. Thank you so much. Yes, you're right.
So thank you very much, Piali and Bako, for that information. We are now 5 minutes over time. So I might just ask Isaac, because I see that your hand is raised and I missed you earlier. If you would like to complement what was raised by Terry earlier, or if it was in regards to the comments made by Bako.
Yes, thank you, Brian. Yeah, it was to complement what Terry said. So how do we move forward as, so we have more of a chronic? Now, I think Uganda is a classic example where we now have more of a protracted situation, and it's no longer that much of an emergency. But one of the things that at least we've done as a response is to advocate for inclusion of refugees into government planning, because that means eventually that when the government is doing a budget, then they include refugees in the planning. That also means that the overall burden on humanitarian actors also lessens. Like I gave examples of vaccines and other things, but then also orientation of the way we respond. In Uganda, we are increasingly looking at, even within nutrition, we are looking heavily within the preventive aspects of it, looking at, say, nutrition-sensitive food systems, investing in those areas, much more investing in behavior change, because then with optimal feeding, it means people are actually able to feed better, and we may actually see less and less of acute malnutrition. And in a way, it also lessens our burden on treatment. But then also the way we deliver. Today, we are having an increase in, say, cash-based interventions, because then these, in a way, boost the livelihoods, boost local economies within the refugee settings, and the refugees are actually able to earn. And by earning means they can even be able to, say, outdo situations where there is reduced food rations. So all this, and even generally also the framework of delivery. So we're talking about the refugee response plan in Uganda, which gives a platform for, humanitarian actors and development actors. So we are increasingly seeing investment by actors like the World Bank through the Dr. D project, So they invest in things like schools and other infrastructure projects within health facilities and even livelihoods. So again, we are seeing an investment coming, more and more money coming through actors that you would less ordinarily see, say, in the humanitarian setting. Then lastly, we're also having, Uganda recently launched something called the Jobs and the Livelihoods Response Plan. So this opens space for the private sector. And we see increasing that refugees, because of the Uganda refugee policy, refugees can actually go and work outside the settlements. They can go and work in tea factories, they can go and work, you know. So that also opens up the opportunity to earn, and by earning more money, it means that they're actually able to deal with some of these vulnerabilities. So generally, we are orienting ourselves towards self-reliance as a way of countering what could have been a chronic issue. Over to you, Brian.
Thanks very much for that, Isaac. So I see that we have a number of other questions that have been raised and also some comments. I do apologize, because of time we will be unable to address them during this event, but rest assured we will respond to them, as we will be developing a frequently asked questions document to complement the satellite event. So we've now come to the end of this event. Many thanks to everyone for joining. I would also like to take this opportunity to thank Terry, Isaac, and Bucko for their tremendous support with this event, and also for your fantastic PowerPoints.